Welcome to Nirmalam.org. In this series, we are going to talk about pregnancy. In this episode, let us discuss about preconception counseling, also called PCC. Preconception counseling is aimed at identifying and modifying risks related to maternal health and pregnancy outcome. Prior to pregnancy, this session is held in the presence of healthcare provider. There are three main components of PCC. Number one being maternal risk assessment, maternal education, and initiation of interventions. Conception counseling is an appointment with your healthcare provider to plan for the future pregnancy. Your family history, risk factors, medical conditions, and lifestyle are all discussed. This appointment is an important part of planned and healthy pregnancy. Maternal risks that can be assessed during preconception counseling include obesity, hypertension, tobacco use, alcohol use, and cardiac diseases. Maternal education topics that can be discussed during preconception counseling include smoking, alcohol abuse, and other drug use, folic acid supplementation, sexually transmitted infections including HIV, family planning and pregnancy spacing, healthy body weight, and diet. Preconception interventions can include educating the patient, providing optimum therapy for medical disorders, and when appropriate, referral for specialized care. Preconception education intervention cover a variety of topics related to behavior such as nutrition, exercise and weight management, birth control methods, STI prevention, controlling chronic diseases, reducing alcohol consumption, quitting smoking and other tobacco use, or improvising mental health. Women who experience depressions or anxiety prior to the pregnancy are more likely to experience perinatal mood and anxiety disorder called PMAD. Cognitive behavior therapy, also called CBT, is the most effective form of psychotherapy for anxiety disorders. Medications combined with individual therapy or group counseling gives you a chance to learn coping skills to help you deal with the symptoms appropriately. Dialectical behavior therapy, also called DBT, is a highly effective type of CBT that focuses on helping you develop what seems to be like outlook, acceptance, and the change. In summary, conception assessments is a combination of medical and psychosocial assessment for creating condition for pregnancy. Nirmalam.org offers cognitive behavior therapy for perinatal mood and anxiety disorder. In our subsequent episodes, let us review other aspects in pregnancy.